These are my disclosures. Before I get started, though, I just want to congratulate you on starting this great society. I was fortunate to be a founding member of the New England Shoulder and Elbow Society, which my partner J.P. Warner founded, and then we founded a Rocky Mountain Shoulder and Elbow Society. But you guys have really taken it to the next level, so we have to up our game. We are not very good compared to this meeting, so congratulations. Thanks to the leadership here for inviting me. It's a great honor, and it's really fun to be here, especially with the presidential honoree, Dave Dines, who I did my first rotator cuff repair with as a med student and resident. So it's really great to see David get honored. So anterior shoulder instability is something that we all see every day. I see it every day in my practice. And we know that range of motion comes at the expense of stability. We know about the anatomy. We talked about that in some of the earlier talks today. Think about the static and dynamic stabilizers. This anatomic study with Travis Decker really looked at the important stabilizers. And it's really the inferior glenohumeral ligament complex and middle glenohumeral ligament complex that are the important stabilizers with the labrum. Anterior instability is about 90% of all dislocations. It's 1.7% of the general population. We all know there's higher rates in men, military personnel, contact athletes, and surgery is required quite frequently to get patients back to activities. The treatment considerations that we need to think about, the history, the physical exam, imaging, we went over this in some of the cases earlier today, but we need to think about the individual risk factor analysis for recurrence and the consequence of those recurrences, and then take all those things together with the imaging, and then sometimes it comes down to your examination or anesthesia, and sometimes even at the time of arthroscopy when you're finally making the correct diagnosis and figuring out what the exact treatment plan is.